investigation, but very sad news that a child under the age of 2, COVID positive, has passed away, and that has now been referred to the coroner. In terms of the numbers for yesterday, what I can report to you is that we had a very significant number of tests that were taken yesterday. In fact, I think it's almost heading towards a record again, with 23,420 PCR tests that were processed yesterday in the 24 hours up to midnight last night, and that resulted in 1,374 positive cases in South Australia. So a slight reduction yesterday on the day before, but these numbers are very likely to be bobbing around for some time. Very pleasingly, we maintained just 37 people in our hospital setting. As you know, we flexed up our capacity ahead of opening our borders on the 23rd of November with an additional equivalent of 400 beds in South Australia. 37 of those, as of midnight last night, were occupied. 4 people in ICU, and 1 of those people remained on the ventilator. So that gives you an indication of the situation that we're in. This morning I convened a meeting of what we're calling the Vaccination Roundtable, where I had members from various sectors, including the AMA, including the pharmacy sector, including Aboriginal controlled or community controlled health organisations, and other people from SA Health. We're all working together now to do whatever we can to flex up the capacity of vaccination here in South Australia. And I really want to thank our GPs and our pharmacists in South Australia for looking at all and every single opportunity to flex up that capacity. I'm very, very grateful for that. And my strong advice to every person in South Australia is get online. There are an increasing number of bookings which are becoming available very, very soon. So I just want people to take up that opportunity to have their vaccination and to have their boosters when they become eligible. I think originally it was described by Professor Murphy as the largest logistical exercise in the history of Australia. It still remains a massive logistical exercise to get so many people vaccinated in such a short period of time. And as of the 10th of January, of course, we'll be allowing the immunisation of those aged 5 to 11. We had an update today from Major General JJ Fruin, who said that those paediatric doses are now arriving in Australia. They'll be distributed over the next week or so, and we will be ready for the 10th of January for the first of those paediatric doses to be administered. There is an 8-week interval between the first and the second dose, and so that's something which we need to also take into account. So over the next sort of 6 or 8 weeks, we're going to be doing every single thing we can to flex up that capacity for our vaccination capacity in South Australia. We've also had a meeting of the COVID Ready Committee today, and ultimately also the National Cabinet. There were 3 critical things which were discussed at the National Cabinet today. The first was the standard definition of what a close contact is. Now, you might recall, if we go back several months ago, we were very, very keen to get everybody that was a close contact or a casual contact into isolation to stop the spread. We were pursuing at that point an elimination strategy so that we didn't put our state into lockdown like we saw in New South Wales, in Victoria and the ACT. We have a completely different strategy. It's a completely different variant, and we're at a very, very different stage at the moment. So we're looking to suppress the transmission of this disease and take the appropriate action for this stage of this particular variant's progress. And so today what we agreed was that we would, of course, very significantly narrow the definition of a close contact. And this will essentially be people who are household or intimate contacts with a positive case, and also each state will look at exceptions or exceptional circumstances in their state. For example, in more vulnerable communities and also where there is a known significant transmission event. So, for example, we might, if you like, flex up the definition of close contacts in a residential aged care facility because we know people there are far more vulnerable, or if we know there have been multiple or a larger number of new cases or community transmission within an individual workplace, then we might have a larger definition of close contacts there. But by and large, we're now significantly narrowing this down as of midnight tonight to those people who are household contacts, intimate partners, or those people in those exceptional circumstances which are determined on a state-by-state basis. We also discussed the issue of the time that both close contacts and positive cases should be in isolation. Here in South Australia, as of the next 24-48 hours, we'll be moving to 10 days for people who are COVID positive and 7 days for those people who are close contacts if they're vaccinated, and will remain at 14 days if they're unvaccinated. So there is a slight narrowing of the amount of time that people will need to stay in isolation. It will just take us a day also to process and get in touch with all of those people who could be potentially in isolation at the moment. But ultimately, if you don't have any symptoms and you've done your 10 days with the disease, you are then right to go back about your business, obviously continuing to monitor any symptoms. We also had a large discussion today regarding the use of the rapid antigen test. It's fair to say that there are increasing numbers now coming into Australia. No state will be giving these away free of charge. This is completely against public health advice, except in circumstances with particularly vulnerable communities. Some states spoke about, there might be a particularly vulnerable cohort that they want to administer these to in a reasonably rapid period of time. But we all agreed that we will be making a transition to more people using the rapid antigen test and getting out of the lineups for a PCR test. Professor Tom Dodd told us very recently that about 2/3 of all of those people lining up for PCR tests in South Australia are asymptomatic. These people really, quite frankly, should not be in the line unless they were close contacts of somebody who was a positive case. We really do want to free up our capacity for testing for those people who want symptoms, and over the next 24-48 hours we'll be looking at putting new directions in place to make it very clear to every single person in South Australia that we really want to test people that have symptoms or are close contacts of those people that have symptoms. So just a bit of advance warning that we will be significantly tightening up on that. We still see a large number of people wanting to get PCR tests in South Australia. It's not necessarily the people that we want to have testing. We really want to preserve that capacity for people who have symptoms or are close contacts of a positive case. To have 66% of all of the tests administered to asymptomatic people is too high. Only 8% of those people tested yesterday were close contacts. We really need to make it easy for those people who are close contacts to go and have that test done, and we'll be looking at transitioning some of our testing over to rapid antigen testing in the coming days, but we'll have more to say about that when Professor Spurrier gives us some advice on that. So I'm happy to answer any questions on the situation. In summary, one tragedy today with a young child under the age of 2 positive with COVID passing away. We've referred that to the coroner. We're not sure of the cause of death at this stage. A slight reduction on yesterday's numbers that were reported, but these are going to be bobbing around. Most importantly, we haven't seen a significant escalation. In fact, we've had a flattening of those people in hospital at 37, well within our current capacity to look after. Look, we're not going into the details of that. It's quite obviously it's a tragic circumstance for the family, and we've narrowed down what we're going to be saying today. It's quite possible that Professor Spurrier will be able to give further details. What I can tell you though is that this child was COVID positive, but the cause of death hasn't been determined yet. Again, I don't have that level of detail with me today. No, look, I think it's important for people to know what our testing capacity is, what our quarantine arrangements are, the general level of infection here in South Australia, and of course what that hospitalisation rate is. Look, it's still too early to say. The Education Minister and the Chief Executive of the Department for Education met today. We've got a cabinet meeting after this press conference, and we'll go through in further details all of the options. It's fair to say that all states are in the same boat. We're looking at what our options are for the start of Term 1 next year.
At this stage, is it likely that it will be virtual?
Well, we're looking at those options at the moment.
You can't confirm whether this child was being treated in hospital or that they are.
Look, I'm just not prepared to. I'm not prepared to at the moment. I've been asked by Professor Nicholas Berry to narrow my comments. The family is obviously in a great deal of distress at the moment. What I can say is that the cause of death has not been determined, but this was a child under the age of 2 who was COVID positive. No, look, at this point it's more appropriate for a clinical reach out, and I know that that has actually occurred. It's a very sad set of circumstances. We still don't know what the cause of death was. Obviously the family is in huge distress, and my condolences to the family. It's a very, very tough time.
Is it possible that...
slight dip in numbers and stabilisation in hospital rates, which is good news, but what does the Omicron modelling say to you and tell us about when this virus might peak and what kind of case numbers we're seeing in the hospital?
So it really all depends. I mean, it's a good question, because what we're all trying to determine is what is that peak load going to be? What is that going to flow through in terms of hospitalisation, ICU admission, and people going onto the ventilators? What I can tell you is that when we received an initial forecast on Boxing Day, we made the pretty tough decision to try and slow it down further in South Australia. We've been pleased that we haven't seen a massive escalation in those people in hospital, but it's still too early to say whether what we did on the 26th is translating into a stabilisation at the moment. This is a very, very transmissible disease. We saw a massive escalation in numbers today in New South Wales, in Victoria, in Queensland. I don't think the other states have come in and posted their figures yet, but we are seeing right around the world a massive escalation in the transmissibility of this disease. More and more people are getting it. The good news is that the severity of symptoms for those people that are vaccinated is much, much lower, and this therefore not translating into anywhere near the hospitalisation or the ICU admission that we saw with the Delta variant. So that's good news. We just don't want to have everybody getting this at exactly the same time. This would overwhelm our health systems right across the country. So we're putting the brakes on here in South Australia as quickly as possible to avoid a disaster. Sorry, I'll just come here.
If the rapid antigen tests are part of the strategy, can you explain to South Australians many can't afford these tests, why you won't make them free?
Well, no state's making them free. What we're going to be doing is to preserve the capacity that we've got for the most appropriate settings. So we've been using it in healthcare settings. Some sectors themselves have purchased their own quantities, for example, the mining sector, the food distribution sector, but it's quite possible down the track that we will, within SA Health, be directing people to take a rapid antigen test and provide that to them, but we're not going to be providing it just generally surveillance for surveillance. That's not being offered by any state in the country.
But at the moment, it's the lowest socioeconomic communities who can't afford them, and often they're the ones that aren't able to work at home. So is there an equity issue?
Well, the issue that we're trying to make clear, and I've tried to make clear in every single press conference that we've had recently, is that if people have got symptoms, they've got to go and have a PCR test, not a rapid antigen test. The rapid antigen test is really only suitable as a screen. Our interest at this stage of the disease is making sure that those people that have symptoms go off and get themselves tested. That's why it's so important that we get those people that are asymptomatic out of our lines, lining up for the PCR test, so that that resource is dedicated to those people that need it. That's what the public health advice is. I think it's really clear, and I'm going to keep repeating it every single press conference that I come to. Yes,
what is the tipping point in terms of case numbers in hospital that will overwhelm our health system?
Well, it depends on the severity, but to date we've got 4 people in ICU. We've massively flexed up our ICU capacity in South Australia, both within our private sector and also in our public sector and also our private sector. This is one of the reasons that we moved yesterday to suspend non-urgent elective surgery in South Australia. It's really important that we do get ahead of the game and make sure that we preserve that ICU capacity, whether it be in our public hospitals or also in our private hospitals. I'd like to thank the private hospitals in South Australia for understanding what we've needed to do to make sure that if we do need that capacity, that it's there and it's available immediately.
In making all these decisions, though, you're presumably acting on modelling. When will that modelling be released publicly, and will it be released publicly to all media outlets at the same time?
So the Doherty Institute has done its own modelling. All we're doing here in South Australia is feeding the actuals into the case, and those actuals we're reporting on a daily basis. There are a lot of moving parts with regards to this. So if you look at the hospitalisation rate, when we were dealing with the Delta variant, there was a much higher hospitalisation rate. What we're seeing with the Omicron is that's coming down to 1.4%, maybe even as low as 1% of cases are ending up in hospital, and about 15 to 20% of those people that are hospitalised ultimately going through into ICU. So the model is updating in real time. The critical thing from our perspective is to slow the spread so that we don't have as many numbers going into our hospital system, and then in addition to that, trying to get as many jabs into the arms as possible, because what we know is that with the Delta variant, the 2 vaccination jabs was sufficient to really eliminate people getting it from in about 80 or 90% of the cases. It's significantly lower with the Omicron, and that's why we need to get those boosters into the arms of people. So it's a dynamic forecast. It's being updated right around the country, right around the world in real time, and it is still too early to be too definitive about this disease.
From your nightclub owners.
On testing, you said yesterday you're encouraging people to go and get a booking in order to get tested, but we can see across a lot of the major testing clinics, those bookings aren't available for a few days, so what are people supposed to do?
Well, this is one of the reasons why we're acting decisively to try and eliminate those asymptomatic tests. So, as I was saying before, Professor Tom Dodd, who is the clinical lead for SA pathology, has made it clear that about 2/3 of all the people in the lines today, yesterday, the day before, are asymptomatic. They just simply shouldn't be in the lineup. We are really trying to preserve that, not for surveillance testing for people that are going on holidays, but for those people who have symptoms, so that if they do have symptoms, we can diagnose their condition, then take appropriate action.
From your nightclub owners.
It's still finding it incredibly difficult to find them anywhere. What is the government doing to make it more accessible to people?
Yeah, so rapid antigen tests are now flooding into the country, and they're being distributed right around the country. There has been a bit of a hiatus because there were some shortages right around the country, but we've been assured today at the National Cabinet that those shortages are now being addressed. In terms of, just sorry, your earlier question, which I should just address, South Australia currently has the second highest rated PCR tests in the country per 1,000 population. We've got the second lowest time that it takes to get a result back. So.
But these people who can't go and get their tests because there's no bookings available, do you expect them to isolate for 7 days?
Yes, I think if people have got symptoms, there's no choice but to isolate ahead of one of those. They don't know they haven't got COVID. And look, we're in the midst of an outbreak here in Australia. We're in an outbreak right around the world, and everybody needs to be working together. If you have got symptoms, you should be treating yourself like you have got this disease and isolating and not spreading it to other people. That's what we would normally expect if somebody had the flu. It's triply as important with regards to the Omicron variant of the coronavirus.
From your nightclub owners.
They're about to enter a heat wave. Just checking all these, many of them are outside these testing clinics.
Yeah, so we've published the expanded times for all of our testing facilities, and I've got to say I'm very grateful to all of the staff at SA Pathology as well as our private testing facilities and laboratories here in South Australia. They're doing a mighty effort. I've had a look around the country at the moment. Some people are doing fewer tests today than they were doing a couple of weeks ago. In South Australia, we've gone exactly the opposite direction. We've got the second highest rate of PCR test availability in the entire country, and I think that's something all South Australians should be proud of. But I've got to emphasise that too many people are going along for screening tests with no symptoms whatsoever. We've really got to preserve this for the people that have got the symptoms. My strong advice to anybody that is lining up just because they're a little bit worried about it, this is not an appropriate use of a very finite state resource at the moment.
From your nightclub owners.
Supporting businesses, when will that be announced and when will it be available?
So we've got a cabinet meeting later on this afternoon. I said earlier in the week that it would be by the end of the week, and that's certainly on track. Sorry, Joel.
Nightclub owners are saying that they don't think the South Australian government wants people to come out for New Year's Eve What's your advice to people? Should they be coming out?
Look, it's a tough one because we want people to be safe this New Year's Eve. There's no point in people having a fantastic night but then actually setting off a massive super spreader event down the track. So our strong advice is consider where you're going to be, make sure that you are appropriately protected, wearing the face mask where asked to, QR code checking in, keeping that physical distance, be outside when you can. I'm hopeful that people can enjoy themselves, but unfortunately this is going to be a pretty different New Year's Eve from many others that we've had.
Nicola Spurrier said she wanted it to be...
I've just answered that question.
Council has just done a press conference encouraging people to still come out tomorrow night and join the New Year's festivities. Is that sort of at odds with what you and
Look, it depends on the issue. Look, the reality is outdoor events are far less problematic than indoor events. We've seen this right the way through this pandemic, right, not just here in South Australia, but right around the country. So for large events, they need to have a COVID management plan. They need to be approved by SA Health to make sure that we are making sure that you can have a fun time on the New Year's Eve, but one that's going to also keep you safe.
Nicola Spurrier said that she wanted this to be the quietest New Year's Eve ever. Do you agree with that sentiment?
Oh, look, Nicola is coming at everything from a public health perspective, and I think she's right to be cautioning people in South Australia, but I think there are ways that you can still enjoy New Year's Eve without risking your health, your safety and the safety of South Australians. So.
Do you feel comfortable with 25,000 people being out later over the
Well, that's the decision that's made in consultation with SA Health. So a ticketed outdoor event which is seated is less problematic than the same number of people all in their own rave parties. So we take all of these things into account. I can appreciate there's some frustrations with regards to this, but we've followed good health protocols since day one in South Australia. They've served us well and will continue to follow those into the future. Sorry.
Can you please explain the local health advice around how our health system will cope under this new definition of close contact?
So if you go back 3 months ago, what we had was a situation where every close and casual contact we wanted to put into 14 days of isolation because we were chasing down every single chain of transmission that existed because we didn't want a case to get out when we weren't very vaccinated, move through society very quickly and overwhelm our health systems. We saw that other states had to basically put their state into lockdown. We didn't want to do that. In fact, we've had the fewest days of lockdown of any state in Australia, and that's something that I think we can all be very proud of, but we're at a different stage now, and so we are no longer asking casual contacts to isolate. We're no longer asking casual contacts to get tested unless they have symptoms, and then we've also massively reduced if you like, the scope of those people that we are now considering close contacts. So again, if we go back 4 weeks ago or 4 months ago, it was a very different equation. We could say that you were a close contact from spending a fairly short amount of time with somebody. What we're saying now is that we're narrowing that down to people that are household contacts, intimate partners, or those people that are specifically directed because they are in a vulnerable setting or they're a part of a larger transmission
So
event.
that will no doubt increase the number of COVID cases in the community and into our hospital system, which is already seems to be struggling with the number of patients that are being ran. So can you just explain how you actually want to advise that it will be able to cope?
Yeah, so look, there's two things that we're trying to deal with at the same time. The first is, of course, admissions into the hospital. The other one is workforce across South Australia. So workforce, whether it be in emergency services, SAPOL, our health system in South Australia, aged care, disability. And so what we're doing now at this stage is taking that advice from the AHPBC, the Chief Medical Officer and our own Chief Public Health Officer in South Australia as to what the appropriate settings are for this part or this stage of the progression of the disease, and that's certainly the advice that has become, if you like, the standard national approach in terms of public health for this stage of the disease.
So you've got hundreds of staff, hundreds of numerous staff that have just been ordered into isolation. What is the government and SA Health doing just to ensure that those clients are well cared for?
So we're working very closely with the residents at Minda at the moment. They have an excellent response plan in place, but they have been overwhelmed at the moment, and so we're offering all supports that we possibly can. Our thoughts are with the residents of that facility, but at the moment there are a number of infections across a number of residential aged care facilities, disability facilities in South Australia, and we're trying to deal with these all at the same time. This is one of the reasons why we're narrowing the definition for close contact so that we can keep our workforce in place, and that means that we can provide services right across our state during this outbreak.
You said that rapid antigen tests are flooding into Australia, but how are they being distributed throughout the states, and how can you ensure that South Australia is getting their equal share?
So there's two different parts to that. One is what's in the public domain. So we have a national stockpile as well as our own state stockpile, and then there's the general sales to the general public. So from our state perspective, I think we have currently around about 780,000 rapid antigen tests in stock. We need those. We use them on a very regular basis to make sure that we can fully utilise them in our health settings and our high risk settings as and when they're needed, and we need to keep that buffer in place. I think we reported yesterday there was a further 4 that have been on order for some time that are due in the next week or so, and then today we placed an order for a further 5 million. So 10 million in the state system overall, which compares extraordinarily favourably with most other jurisdictions in the country.
Australia is reportedly making these rapid tests free.
That's not correct.
Some are being sold, for $90 at supermarkets, which is twice more than what they're usually sold at. Would you say that that's unacceptable given the demand?
I haven't seen that, but obviously we're calling upon all retailers to do the right thing. These rapid antigen tests will be a huge relief to people that get their hands on them. We're wanting to make sure that they are setting them at a fair price for all South Australians to enjoy. Obviously, we're very keen to get much greater supply into South Australia as quickly as possible, and that's going to be able to be something which will probably also lower the prices.
Can we just get clear on this point?
Sorry.
But if we are massively loosening our definition of close contact, how is that slowing this rate of
Well, there's multiple things that we're doing at the same time to try and slow the spread, but if you don't have the workforce to respond, it's going to get out of control. So, look, there are no easy choices in any area of the Omicron variant that any government around the world is facing. But what I can say is I think South Australia is in one of the very best situations possible to deal with this new Omicron variant. It is highly transmissible. It has the potential to overwhelm health systems if it's not taken very, very seriously. That's why we moved on the 26th of December with the new forecast that had been provided on likely numbers around the world, that we would slow down this disease, put the brakes on this disease. And so we've gone hard, but we believe by doing this we will save lives.
From the outside, the ambulance union told us that 4 COVID positive patients were ramped at the Royal Adelaide Hospital. 2 of those patients were ramped for more than 90 minutes. Would you say you were ready to open the borders to deal with this?
Well, look, I have dealt with this quite a lot. The Omicron variant has got literally nothing to do with opening the borders on the 23rd. And I've got to be really clear about this and just make sure that you're all really clear about this as well. The borders were opened on the 23rd of November. Omicron wasn't even discovered until the 28th, I think, of November. So, you know, it's just not, it's not comparable. The whole situation with regards to COVID has changed right around the world, and we've had to update and change our plan. What I can say is that South Australia is in a very good position compared to most other places in the world, but we have got a real challenge on our hands. But like we have with other variants, we rise to that challenge by people working together.
What is the system was ready for borders to open?
Correct, yes.
What is the line at the end of the tunnel for South Australians? You know, initially it was 80% vax rate, now it's not. Then it was 90, now it's.
Yep. So let's go through this again. We open the borders.
I want to look back, I want to look forward. I think South
But you're asking,
Australians
no, it's really important to go through this because sometimes there's a different group of people here every day and they haven't heard the previous press conference. It's really important to go through this. So we opened the borders based upon the Doherty Institute modelling, which was based upon the Delta variant. And so the borders in South Australia were open on the 23rd of November. So South Africa didn't even report the Omicron variant to the World Health Organization till the 24th, and I think they declared it a variant of concern on the 26th or the 28th of November. So we were certainly ready, and in fact, if we look at the number of Delta cases in South Australia, they have been well under what we were predicting would have occurred under the Doherty Institute model. So we were 100% ready. But what has happened in the last 4 weeks has occurred to the entire world, not just to South Australia. Nobody had a crystal ball about what could have happened with Omicron, and we are responding as quickly as we possibly can at the moment.
Last question.
Yeah, Premier, I was just going to ask you, we've been hearing that there may be some COVID positive.
Just take that down a little bit, sorry.
We've been hearing there may be some COVID positive cases at the Adelaide Women's Prison. Is that the case? And if so, what's being done to protect the staff and the inmates there?
I certainly haven't received an update on that, but I'm happy to follow that up for you.
Sorry, I just need to
Yes.
follow up because Victoria says they are making rapid antigen tests for it.
No. Look, as I said only a few minutes ago, we've made a decision at the National Cabinet. There will be some discrete, vulnerable communities, just like we would have, where we might say, well, look, we're going to make them free for aged care facilities with a certain outbreak, or maybe an Indigenous community. But the concept of widespread provision of free testing is just not... I've only just come from that National Cabinet meeting.
I'd like to
Thanks very
return on the
much.
business compensation package.
Yes.
Will you be announcing that to all media at the same time?
Yes.
Is it reassuring that we've had a drop in cases today, or are we going to just see it come and go?
Look, I'm hopeful that this is a good sign, but I'm also realistic enough to know that our numbers are going to bounce around. I suppose going forward, I'm probably more concerned about hospitalisation and admission to ICU rather than that top line, which is going to